What is delirium? Delirium is an abrupt change in the brain that causes mental confusion and emotional disruption. It is not caused by a neurocognitive disorder, but anyone can develop it due to underlying infections, medications, or withdrawal/intoxication to drugs and alcohol. It is most common in people over 65, and this impairs their ability to think, remember, and sleep. The diagnosis of delirium. The diagnosis of delirium is assessed by the 3 C's: cognition, course, and cause. In cognition, there must be a change in at least 2 cognitive domains. This includes memory, disorientation, and language. In the course, it has to develop over a short period of time, and in the cause, it has to be a direct psychological effect of a medical condition or substance. The assessment of clinical status. Assessment of clinical status is assessed by Folstein's mini-mental state exam. This is a state exam that is based on 30 points and it is used to measure cognitive impairment. The lower the score to 30, the more cognitively impaired the patient is. Some questions that are asked are about locations, as in where are we. This includes the room, floor, hospital. Other examples of questions is spelling the word world forwards and backwards. And another question is having the patient copy a simple design of a certain shape overlapping. Another assessment of clinical status is using the acronym SAD Persons. SAD Persons assesses for the potential harm to self or others. The S in SAD Person stands for sex. If you are a male, it is worth 2 points, and if you are a female, it is worth 1 point. The A stands for age. If you are an age in between 20 and 44, then you'll have 1 point. The D stands for depression. If you were previously diagnosed with depression, you would have 2 points. The P in PER stands for previous attempt of suicide, which would be 1 point. The E stands for excessive alcohol or drug use or ethanol, which would be 1 point. The R stands for loss of rational thinking, and that would be 2 points. The S in SONS stands for lack of social support. The O stands for organized plan. So if a patient had an organized plan of how they would harm themselves or others, that would be 2 points. The N stands for no spouse, and the S stands for any sickness, whether that be chronic, debilitating, or severe. Psychiatric management means that it identifies the etiological factors, which is done by using acute intervention and non-urgent assessment. For acute intervention, patients with delirium may have a general medical condition that requires urgent therapeutic intervention. To assess for this, they do an EKG, and then the patient could be put on 1-to-1, which means that one person, such as a nurse, will have to be with them 24/7 to make sure they don't harm themselves or others. They would also have to see the impact of any drugs there are and how urgent treatment is needed. Non-urgent assessment is guided either or not by history or medical exam. This is done with the acronym I Heart Lady Macbeth. The I stands for immunologic, which could be an example of having lupus in which the immune system attacks healthy tissues. The heart stands for heart cardiac rhythms, and it is done by using an EKG. The L in lady stands for lumbar puncture, which could be meningitis. The A stands for anoxia, which could be hypoxia, in which the brain is not getting enough oxygen. The D stands for drugs that can be prescribed, recreational, or illicit, and the Y stands for yaws, which is an infection of the skin, bones, and joints. The M stands for malignancy. The A stands for ammonia, which could be hepatic encephalopathy, which is a decline in brain function that occurs as a result of severe liver disease. The C stands for CBC or CMP, which is a complete blood count and comprehensive metabolic panel, so this could either be pneumonia, UTI, or infections. The B in Beth stands for B12, folic acid, and thiamine. These could either be deficits in one of those. This can also cause Werwinkel's encephalopathy. The E stands for an EEG, which is an electroencephalogram. This could be an example of hyperthyroidism. The T stands for a TFTS, which is thyroid function test, and it tests for encephalitis. The H stands for head, so this would be an example of a CT or MRI scan, which could assess for tumors and abscesses. Environment and supportive intervention. Environmental interventions reduce factors that may exacerbate delirium. This could be, for example, changing the lighting to cue day and night, reducing over and understimulation, correcting auditory and visual impairments, and to make patients' environments more familiar by showing them old photographs of family members. Support for families include encouragement to frequently orient the patient and provide education to reassure the family. Specific somatic interventions are the medications used to treat delirium. An example of an antipsychotic medication is haloperidol, which is known as Haldol. This is provided for agitated patients and more reliable for absorption. Haldol may be administered orally, intramuscularly, or intravenously. Intravenously is considered superior to orally because of how fast it is absorbed. The next antipsychotic medication is droperidol. It may be considered for agitation or onset of action and the greater sedative properties and shorter half-life. Another antipsychotic medication used is chloromazine, which is associated with a higher risk of seizures. Benzodiazepines are also considered, and examples of these are lorazepam, diazepam, and chlordiazepoxide. Lorazepam helps with seizures, and diazepam and chlordiazepoxide helps with the withdrawal from alcohol and hypnotics. Vitamin B is also used to treat delirium in that thiamine is used to help with Werwinkel's encephalogy from excessive drinking. Thank you all so much for watching, and make sure you like and subscribe.